This is Dubai Eye 103.8.
The region's favourite doctors, live and listening.
Doctor, give me the news.
On afternoons with Helen Farmer.
And the doctor of the day is Dr. Yasir Parviz. He is a consultant interventional cardiologist at the Canadian Specialist Hospital. Welcome, doctor. How are you?
Hi, Helen. Thank you very much. I'm fine. Fantastic.
I'm so happy. When you walked in, I thought, he's a cardiologist and he looks healthy.
Because, thanks for your compliments.
Because you'd be surprised how many doctors that I have met, both through the show and, out in the wide world, where I think you're maybe not the best advert for your services. Well, can I ask you, how important is your own health and what kind of diet and lifestyle do you follow?
So thanks, Helen, for giving me this opportunity. So I try my best to follow healthy living, because most of the time when the patients come in, they look at the doctor and they see, is the doctor himself healthy or not?
How big is the tummy? That kind of thing.
Absolutely. So whenever you go to a dermatologist, you want to see your own skin, yeah? So all the girls, they want to make sure that the doctor has
it's got to be aspirational, hasn't
Absolutely. So what I try to do is that I try to stay relaxed, okay? I try to focus on things that are trying to keep me calm and relaxed during my work and job. I have a family. I do have 2 boys and a girl and Mrs. of course, but I wake up very early. So here in Dubai, I will wake up in the prayer time. I'll do something odd. I'll run to the mosque for 15 minutes in the morning in my sneakers. I'll pray and then I'll run back home. I'll have breakfast that will be very light, and then I'll go to work. Most of the time, my colleagues do make comments that I don't have lunch, but I do have fruits. So I'll have bananas or some sort of dry fruit, and I'll have dinner, but most of the time it's not like following the Dubai lifestyle. I'll still follow the UK. I'll have an early dinner, and then I'll go for a walk, and I'll try to sleep early and not watch too much TV or go out on the bars or have shisha. So
sleep, we're going to be talking about the importance of sleep because I think in general health, but there seems to be interesting data around the impact of good sleep in cardiovascular health as well.
Yeah.
I'm really curious about your title, Consultant Interventional Cardiologist. What does that mean? What's the distinction there?
So, Helen, this means that I'm one of the doctors who is doing these fancy procedures, but I'm not opening the chest. I'm doing it through the very small wrist or through the keyhole. The procedures are done in such a way that when there's an immediate relief to the outcome or for the heart attack, and when they come out of the theater or from a laboratory, the total scar that they're going to get is like a mosquito bite.
Wow.
So many times the intervention cardiologist is the one, they say that he's a guy who has a hand of a lady, eye of a hawk, and heart of a lion. So
Wow.
I'm the one that is treating these patients immediately and quickly that are requiring the treatment. But I'm not only an intervention cardiologist. I am a cardiologist, first of all, a physician. I see my patients, I talk to them, I listen to their concerns, and then I do these fancy procedures, what is in the title, intervention cardiology. Yeah.
How important is that communication with the patients, especially for somebody in your kind of role? Because I suppose most people, certainly myself, I'm sure many other listeners would be thinking, well, the main relationship I have with any kind of medical professional is with my GP. And that's it, really. But you look to build relationships. You look to, I suppose, do you look to really get to know each and every one of your patients?
Absolutely. So I'm going to tell you slight difference in the practice here in Dubai versus UK. So here we are trying to build our own practice. So I am the first contact with the patient. So I see the patient. The communication skills are one of the most vital part to give the patient satisfied. So we have to listen to their concerns. So whatever is coming with, I'll listen to the concerns and try to address in whatever simple language and try to avoid whatever the fancy medical terms I have.
And that's what I'll be doing between now and 4 o'clock. If you use any fancy medical terms, I will. But I think especially with cardiology, people start thinking about heart and your mind just goes to the worst case scenario. So you must be dealing with people who, are upset or, concerned about their condition or that of someone in their family.
Yeah. So you're right. So for me, you can always have a debate. What is the most important organ in your body? So heart or a brain? So yes, heart, people are always worried. And there is a lot of stigma that the leading cause of the death is the heart problem. And people want to get more information about their heart and the situation. But as a cardiologist, when they come to my clinic, as you made a comment that maybe I looked young, so I do tell them that we are not trying to treat something very serious. We are just trying to prevent the problems. So our aim is to talk, to listen, and whatever concerns you have so that you don't get a heart attack. So I have no intention that I want everyone to have a heart attack. I don't want anyone, so that they can listen and prevent this problem.
Dead patients are very bad for business. We want to prevent and keep people healthy and keep them coming back.
Yeah.
Can I ask you, what kind of problems are you seeing coming into your practice? What are the common issues here in the UAE?
Yeah, so as you mentioned that heart or heart-related problems are one of the leading killers here in UAE.
The data worldwide is phenomenal. Combined 15.2 million deaths in 2016, and the leading cause of death globally according to the World Health Organization. So,
you're absolutely right.
And the UAE is absolutely not an anomaly from that.
Yeah, so I was lucky enough that I worked in UK, I worked in Canada as well as in US. I had opportunity to work in Columbia University. So I am seeing here that the people in UAE are dying about 20 to 30 years younger than UK, Canada, or US. And this is because we are seeing these problems very early in 40s. So in UK, for example, you will have a heart patient in the age of 65 to 70. Here you will see in 30 to 40. So we do see patients with heart attacks. We see a lot of patients with high blood pressure, high cholesterol, all of those issues related to the heart.
I'm glad you're here because I never really understand the numbers or when I get my blood pressure done. Can you explain a little bit? Because they go, oh, it's this over this, that's normal, or this over this, it's low
so
or
you're
high.
Absolutely right. Many times as a doctors, we don't understand as well. So many times patients are coming and they give me a number that, I have 120 by 80. So as a physician, as I said, that we are not only intervention cardiologists, we look at the patient as a whole. So as a physician, we are advised that don't look only at the numbers, look at the patient and look at his risk profile. So a number 120 by 80 is different to one individual in comparison to another. So let's say somebody has a sugar problem, has a kidney problem, who's a smoker, has a high cholesterol with maybe big tummy. His blood pressure of 140 by 80 is different to someone who has no other risk factors. So numbers do matter, but have to look and see a physician and then get the proper advice.
They don't give you the complete picture.
No.
Questions come in from Martin saying, wife is 19 weeks pregnant and has had to go to the doctor 3 times in the past 2 weeks due to high blood pressure. It's been high each time she's gone, but each time they've tested for protein in urine, which is always negative. She was born at 23 weeks, and doctors scared us this morning by saying she might go the same way as her mum did. No other signs of preeclampsia, but very scared. Can the doctor advise of high blood pressure this early in a pregnancy?
Yeah, thanks very much for your question. So as you mentioned that there is some concern regarding preeclampsia or eclampsia or high blood pressure during the pregnancy. So whatever the doctor is doing at present is doing the right thing. So he is checking the protein and making sure that the high blood pressure is not having an impact on the kidney. So the aim for the physician or the doctor is to keep the mom safe and keep the baby safe. So that's why the regular visits will be important, but it does not mean that this thing has happened in the family, that it will have an effect on the individual patient as well.
And stress is not going to help that. So
absolutely. So we need to just try to be a bit more careful, have a regular visit to the doctor, listen to the advice of an doctor. Although I'm here in 103 and we are in a media, so my advice will be not to do your own internet search and treat and
Dr. Google is not the answer.
Yeah, so I didn't use that word. So, because I'm in the media field, so I will request that please follow the gynecologist, have a regular checkup with cardiologist, and hope for the best. It does not mean that you will have the same outcome as before.
Really quick question from Handam, but one I think is really interesting, saying, "Hi, doctor. What is the difference between a heart attack and cardiac arrest? Is there a difference?"
Yes, there is a difference. So heart attack basically is a condition where there is a damage or injury to the heart muscle. So we're not going to go into the technical terms, but one of the commonest reason is that one of the arteries of the heart, the pipe supplying the heart, gets blocked or narrowed. So remember that the heart is a muscle that supplies the blood to the whole of the body, but heart itself needs blood as well to live or survive. So one of the commonest reason is that one of the arteries or the pipes supplying the heart muscle gets blocked. So cardiac arrest is a situation when the patient has no pulse and the heart has stopped beating. It's a different condition. One of the commonest reasons for cardiac arrest can be a heart attack, but heart attack is different and cardiac arrest is different. So when somebody cannot feel the pulse, then there is a different treatment strategy that we need to do, and it's always better to ask for help and dial 999.
We're taking your questions this afternoon. Danny had a message on 4001.
Yes, this one here. So apologies if I get the pronunciation of this wrong. I have tachycardia, if that's correct there, which happens quite often and can go up to 200 per minute. Sometimes it doesn't go away by itself, and then I have to go to hospital. I've had checkups with not much results or the cause being known. I've had some medicine, beta blocker, had it for months, but it didn't have any result leading from that there as well. Do you have any suggestions at all?
Yeah, thanks for this. As you know, that most of the time, as a physician, we will like to see the patient face by face. So this information is enough for me that there is someone who has tachycardia. I know your tachycardia is absolutely fine, but tachycardia.
And what is that?
Yeah, this means that the average, what we say is that the heart beat should be between 60 and 100. So when we say that the heart is beating more than 100, we call it tachycardia. When it's less than 60, we call it bradycardia. So this patient who is having an increasing heart rate that is more than 100 and sometimes it goes up to 200, so ideally I will request the patient to see a cardiologist. So I understand the patient has seen a cardiologist or a physician and could not find a cause, but a 200 heart rate is making me feel and concerned that we should seek an expert opinion. So there are a lot of reasons for that, but request will be to come and see us so that we can give you further evaluation. Current situation in 2019, we have too much resources, too many techniques or technologies available. So you should not start getting worried. Okay, we can find out and we can help you sorting your problems. So there are many patients who can have heart rate of 200, they get beta blockers, they don't feel better, they come and see an expert and we can give you advice. So at present, don't worry.
Yeah.
See an expert.
I mean, because you hear that 200 per minute, so I'm thinking that's when I'm at my absolute maximum working out, perhaps. And I always remember kind of at university studying like kind of sports coaching and sports science and that, and being told there was a kind of idea about what your maximum heart rate should be. I think it was 220 minus your age.
Yeah.
Is that like one of these old myths? Is that one of these old wives' tales?
I'll agree with you. But someone who is fit like you, who's always having a heart rate, let's say 60. So even when we request you to run on a treadmill, we might not achieve 120. So it depends on the different patient. So this particular patient maybe is having a heart rhythm issue, but we cannot give a diagnosis on the media. We want to get more information before we keep the patient.
Question here from George, Dr. Yasir, saying, I'm 69 years old, no heart issues, take medicine for high blood pressure. I take Concur 0.5 milligram as advised by my cardiologist, but my pulse goes down to below 50. Is this okay?
Yeah, thanks, Helen. Concur is one of the medicines that can be used for treating the high blood pressure. One of the effects of this medicine is that it's trying to slow or relax the heart. So this heart rate coming down to 50 is still okay, as long as the patient is not having any other symptoms. But if you start getting any symptoms, what I mean is lightheaded, dizziness, or any other concerns, please consult your doctor.
But below 50, looking at the numbers and no other issues?
No, I think we're okay.
One thing I'd love to ask you about is genetics. A lot of people will claim that either they are predisposed to having diseases like cardiovascular disease, could be things like Alzheimer's or whatever, where there's another train of thought which thinks that, although genetics may play a role, it's not your destiny in a sense. Can you kind of clear that up for us? How much of a role do genetics play, and is it, if that's the path you're on, is that it?
Yeah, so in heart or heart-related condition or cardiovascular health, genetics do play a role. So there are a few things that you cannot change, like where you were born, which family you were born, and maybe the age as we grow older. So genetics do have a role, and let's say we particularly talk about heart attacks. or having the narrowing of the arteries, we have seen that there are few races or regions they are more predisposed. So let me give you an example that people living in Southeast Asia or India, Pakistan, this region are more predisposed, and one of the reason is genetics. So when genetics, then it comes with other factors that can add on effect.
So you say that about, so it's like kind of being predisposed to it, but it's not necessarily the path you have to go down. So it's got to be the combination. I suppose the combination you mentioned there, I suppose it's all about lifestyle, isn't it? So what are the key lifestyle aspects that you need to consider, especially if you are one of these people who maybe your family has got a history of cardiovascular disease? What are the things that are most important to you?
Yeah, so if you have a family history of heart problem or cardiovascular disease, then you need to be more vigilant. You need to be more aware of the things that you should not do. So even for the kids in the school, they're trying to teach that don't smoke, walk, look after your weight, check your glucose, check your blood pressure, stay relaxed, do more walk, and consult your doctor. And reduce the stress. These are the things that you should try to modify. So it's not only the genetic. It needs to be some environmental factors,
you
some other
You take
factors.
responsibility for yourself as an adult.
Yeah.
We love sleep, don't we, Danny?
We do, especially at the moment.
Yes.
Danny is especially passionate about sleep at the moment because his book is all about that very topic. And I listened to a TED talk from the same author. And one thing he talks about the importance of sleep on everything from fertility to cardiovascular disease. But he said when it comes to cardiovascular, that an hour can make such a huge difference, and said there is an experiment that happens every single year with over 1 billion people involved, and this is when the clocks change. So, we don't do it here, but in certain parts of the world, spring forward, fall back. And what they found is when you lose an hour's sleep, they saw a 25% increase in heart-related issues going into hospitals and clinics. And then conversely, when you gain an hour, they saw that reduced by around 20%. So not to be underestimated. How much sleep are you getting, Doctor?
So at the start of our conversation, as I mentioned, that I try my best to have at least 7-8 hours. Okay, but because of my job as an interventionist, so I will maybe if there is an emergency in the hospital, I'll wake up at 2 a.m. I'll go, but I try my best to have at least 7-8 hours. And you're right that sleep is having an impact on the health, and losing 1 hour or gaining 1 hour, this is called some sort of technical term where we release too many hormones in the body, and there are some harmful hormones. They can pile up in your body if you're not relaxing and detuning your body. So yes, adequate sleep is important.
And obviously not having enough sleep can have an impact on mental health, it can have an effect on weight gain or weight mismanagement as well. So what about diet? And Danny, you've been listening to some really pertinent podcasts around this that I'm really glad Doctor's here to comment on.
Yeah, I mean, obviously, just to tell you first up, obviously most regular listeners will know because I get introduced to it all the time anyway. I'm kind of the resident vegan of the place.
Danny,
but one of the main reasons that I am
Yeah.
vegan, as well as the ethical and kind of environmental aspects, is the health aspects as well. And I know one of those as well, a lot of the big claims about veganism, in particular a whole food plant-based diet, is the positive impact it can have on cardiovascular disease. Some doctors, even like the likes of Dr. Ornish, Dr. Esselstyn, saying that they believe that you can reverse heart disease by moving on to a plant-based diet. 2 questions. First up, is heart disease and cardiovascular disease actually reversible? And how important is diet to that? And what kind of diet do you recommend?
So as you said, that there are few things that we can modify. So one of the genetics we can't modify, but the diet is one thing, as you are trying to do, or I might try. That diet is one thing that we should consider. And there is enough evidence that having fresh fruit, vegetables, these sort of things can help you reduce the cholesterol level. So the basic concept comes that because there's a plugging of your arteries or those pipes, and that are plugged up by buildup of cholesterol. So when you're having vegetables, fruits, and a lot of those sort of things in comparison to too much oily stuff or fat, you will be at advantage. Going completely vegan, there are evidences, there is information. I will just say that eat in moderation, okay? we don't want to have too much stress in life, so we want to enjoy our life at the same time. So fresh fruit, vegetables, whatever food you like, have it in moderation, do exercise, and sleep well, and your heart will be healthy.
Liz has been in touch saying, I had a heart attack here 3 years ago. There was a genetic predisposition as my mother had it. Even though I exercised, had good weight and low cholesterol, it still happened. And 3 stents later, all is under control. Good to hear, Liz. And no name on this one saying, my mum passed away at 67 from hypertrophic non-obstructive cardiomyopathy. Had echo at age 20. Don't feel anything now. I'm 42. Do I need a Torchek echo? Mum was first diagnosed about age 40. What advice would you give there, Dr. Parviz?
Yeah, this condition where you have hypertrophic cardiomyopathy or hypertrophic non-obstructive cardiomyopathy, the request will be that you have regular checkups and have a scan of your heart done. So that scan can be a simple scan, an echocardiogram, or it can be the way you guys have mentioned, TOE or transesophageal echo. So we do recommend to have it every few years.
You're saying, even there, not feeling anything at 42, but you might not feel anything, but still worth having that investigated.
Absolutely.
Speaking of that, Lola's asking on 4001, good afternoon all. I would like to check how often do I need to check on my child who has got hypertrophy. What is hypertrophy?
Hypertrophy means that something is big, like hypertrophy of a muscle. Let's say when we are doing too much exercise, so we can have a hypertrophy of our biceps. Same thing is that there is a thickening of the muscle of the heart. That can be because of so many reasons. So if it's happening in the child, so it be genetic. So request will be to get it checked and have a scan done.
And how often would you recommend having that
checkup? So that depends on the severity of the condition and how bad that is. So mostly in kids, it's every 4 to 5 years.
Okay, I really hope that helps and hope your little one's all right. I'm wearing my Fitbit right now. Danny, you've got a bit of wearable tech on.
Yep.
We're representing all brands, Apple and Fitbit. Can I ask you about some wearable technology? Mine's telling me right now that my heart rate is at 60. That's all right, given that I'm on air, isn't it?
Of course, you're relaxed and chilled out. And
I'm speaking to tens of thousands of people. What could go wrong?
Yeah, 60 is a good heart rate. Yeah.
And Danny, where are you at?
68.
That's all right.
I've just been moving around as well.
All right, don't get defensive about your heart rate.
Both of you are fit and active. Yeah.
How reliable are these bits of wearable technology, Doctor?
So this is all at present controversial. So we don't have large-scale medical data to look into. So basic information, as you said, about the heart rate or looking into how fast it goes or number of steps you have done, it's okay. But you remember that one of our listeners had a question that my heart rate has gone up to 200. So this device might not be able to give you the type of rhythm what a cardiologist or an expert is interested in. So at present, for the basic information, the manufacturer are saying the same. So if there is a concern, always see an expert.
What about the kind of special abilities that a lot of them claim to have, at least anyway, where they can tell, they'll read your heartbeat consistently, and if there's something irregular and if it continues for just a short amount of time, they'll basically call the emergency services. I think there's a story over in the US of a woman
who fell
and they could tell, read her heart rate, and elderly woman, and essentially the claim is that the watch she was wearing, the kind of wearable device, saved her life.
Yeah, you're right. So there is not only a campaign or information from the device manufacturer that it can alert the medics or it can ask for help early. So you're right, but as a scientist or as a doctor, we always want to have a large-scale scientific data to make that judgment. So you might have seen from Liverpool that somebody is on the field, he was collapsed. Then you start looking into that whether the watch was there or not. So always have to have a scientific information and data. What is the reason? So basic information these devices are all giving you. So it alerted, it's okay.
Proceed with caution.
Yeah.
And just finally, before we let you get back to clinic, Doctor, what are some of the red flags that we should be aware of, whether it's genetic predisposition or not? What can we be aware of to make sure we are in good health when it comes to our hearts?
Okay. So as we said, that always look into those modifiable risks. Always keep an eye on your blood pressure, sugar, walk, don't smoke. If you start getting any chest pain or discomfort and you're feeling some uneasiness, So my message is that don't make the judgment at home. So many times even the doctors, we've confused that is it a heartburn or is it a heart attack? So request will be that whenever you get an uneasy feeling in the chest or difficulty in breathing, always ask for help.
And fingers crossed it is just a big lunch and a bit of indigestion.
Yeah.
Dr. Yasir, thank you so much for joining us from the Canadian Specialist Hospital. Some great advice there. Stay healthy.
Thank you very much.
This is Dubai Eye 103.8.